Coomer?
Dr. Stites, thanks for joining me.
What? You're joining me?
No, you're joining me today.
No, it's Open Mics with Dr. Stites. You're joining me.
Get the memo. It's
No,
Coomer.
wrong.
Doctors, you're co-hosting. Stick to the script, please.
What's going on?
What? I'm not co-hosting with you.
I'm not co-hosting with you.
Oh, jeez. What is this? Like Christmas? I have to give away the stage here? No
Who
way,
did
man.
this?
I don't know. Not my idea. It must have been yours.
Not my idea.
You're gonna have to share the spotlight, doctors.
Unbelievable.
Well, can I go first?
I think we're gonna have to roll an encore till they figure out who's on first.
All right, everybody. Let's cue up the holiday encore of Open Mics with Coomer and Stites.
And by the way, you know it is Stites and Coomer. None of this Coomer-Stites stuff. I'll show you how it's done, starting with the slouch.
Uh-oh. Stites is slouching again.
Good morning. I'm Dr. Steve Stites, Chief Medical Officer here at the University of Kansas Health System and Executive Vice Chancellor of the University of Kansas Medical Center. Welcome back to Open Mics with Dr. Stites. A lot of people have battled a weight problem for years. Often the extra pounds lead to other conditions such as diabetes. And research published in the Journal of the American Medical Association is comparing the two main treatment paths for those who are living with obesity and diabetes. The study pulled data from 4 different randomized controlled trials looking at several hundred people with type 2 diabetes. And its key question was, what's better at getting their glucose under control, bariatric surgery or medical and lifestyle management? According to this study, bariatric surgery achieved much better long-term control of blood sugars compared to people who only received medical management and lifestyle interventions. With us is bariatric surgeon Dr. Jennifer McAllister from the University of Kansas Health System, who's going to help explain the process of weight loss surgery and what you need to know if you are considering it. Also joining us is one of the patients from that surgical program, Lachey Haynes. I said pretty close, right? I'm pretty close?
That's correct.
Awesome. Who is going to share her experience with diabetes and with the surgery. And Dr. John Tifo. John is director of the KU Diabetes Institute and co-principal investigator of KC Moore, the Kansas City Center for Metabolism and Obesity Research. Thanks everybody for being here this morning. Appreciate having you.
Morning.
All right, Dr. Tifo, Dr. McAllister, the conclusion of this study was that bariatric surgery outperforms lifestyle medical management when it comes to managing type 2 diabetes. Is that a widely accepted conclusion? Does this study change how we compare those treatments a lot?
Well, I'm not surprised. I think it's pretty clear that the degree of weight loss and the maintenance of the weight loss is far better with bariatric surgery. And so it has a more profound effect on glycemic control in diabetes. But I also want to say that a lot of times our lifestyle interventions for people with diabetes through clinical care are not that robust either. They a lot of times just focus on a few meetings with an RD, not a lot of physical activity. Dietitian. Yep. Not a lot of physical activity, exercise, information. So I think we could do better there, but I'm not surprised that the surgery is more effective.
Yeah, and I would have to agree. You know, we've known for years that bariatric surgery is effective for weight loss, and this study adds to our knowledge that it's a very effective treatment for diabetes. And not only diabetes, but also high cholesterol, hypertension, sleep apnea, risk factors for cardiovascular disease, and also decreases the incidence of cancer in post-bariatric patients. And so what we really need to call these are metabolic operations and not specifically weight loss operations.
Yeah, that makes better sense to me. Now, just to clarify, the study we're talking about is focused on type 2 diabetes. Dr. Tifo, could bariatric surgery help people who have type 1 diabetes as well?
Well, historically, people with type 1 diabetes don't have obesity.
Right.
They would actually be underweight, but there is now data, especially in adolescents with type 1, that they have obesity rates on par with non-diabetic kids and maybe even higher. So maybe it's something we explore someday, but right now I don't see that as a treatment for type 1 diabetes.
So lots of stuff about the GLP-1 agonists like Zepbound or Ozempic and things like that. Were those drugs on that in this study?
I don't think they included those as a part of the lifestyle
I don't think they
management.
did, right? That was my question. You look at the study, like, well, wait a minute, they don't really include the GLP-1 agonist. So would GLP-1 agonists have given us a different story? And again, that's Zepbound and Ozempic and Wegovy and all that.
But remember that the GLP-1 agonists first came out for improving glycemia. So a lot of the diabetes patients are already on these drugs, and they have their weight maintained on those drugs. So if they were on them, they were probably on a dose that was causing weight maintenance.
Okay.
Right, and it's fascinating to remember that these are fairly new medications, especially indicated for both diabetes, but then separate indications for weight loss. And, with the bariatric operations, for years we didn't quite understand the mechanism of how they worked. We'd say we make the stomach smaller, you can't eat as much, we bypass part of the small intestine that would have absorbed those calories. And what we now know is that, it's a fascinating mix of how our body feeds back to control our hunger. And so what we know with the bariatric operations is that we see a natural increase in our body's own GLP-1 after surgery. With food entering the small intestine more rapidly, we have what's called enhanced nutrient sensing that increases our body's GLP-1, but then there's also multiple other hormonal changes too. And so it's all of those changes that we now understand much more thoroughly that really sees the enhanced benefits from bariatric surgery.
The gut does have a mind of its own, and we talked about that in one of these programs in the past. So, can surgery actually eliminate a patient's need for diabetic medication by just bringing in under good control, do you think? Is that a possibility?
Oh yeah, there's high rates of resolution of diabetes after bariatric surgery, and that's been known for several years.
So what are some of the risk factors of bariatric surgery, Dr. McAllister?
Well, these are safe and effective operations. They're now done in a minimally invasive format where patients usually stay one night in the hospital, sometimes less than that even. But all surgical procedures have risk. What we know large scale is that these operations are safer than having a knee or hip replacement, almost as safe as having your appendix out. There's risk of infections. Post-op recovery, ambulation, and movement is key. That's part of overall success, but decreasing any risk factors after surgery as well.
All right, well, let's talk with one of your patients. Lachey, welcome, and thank you for joining us this morning.
Thank you.
Thanks for coming up and telling your story on this program. Now, you were gracious enough to share some of your photos both before and after your bariatric surgery in June of last year, so 2023.
Correct.
So, first of all, that's a pretty remarkable change of those two photographs, right?
Thank you.
So I was taught, I was taught you never ask a lady their age, you never ask people if they're pregnant, man, and I have had enough foibles around that in my life and stepped into it and done stupid things. So I'm not going to do that, but if you volunteered it, that'd be okay. How old are you?
I was 377 pounds when I started out with the weight loss surgery. Now I'm down to 188.
Holy cow, that's a lot. Congratulations, well done.
Thank you.
I'd say let's go Royals, but that's a let's go Lachey, I think, right there.
Thank you.
So 200 pounds, 15 months, holy moly, what's your goal?
My goal was 200.
All right, so you're at goal. That's awesome. Now, first of all, has that completely changed your life?
Tremendously.
Talk to us about that.
Well, the reason why I say it changed my life, it changed my day-to-day activity. When I did have the weight on, I couldn't get it around. It was hard to get out the bed. I had trouble breathing. I was taking like 20 to 30 pills for diabetes, GERD, acid reflux. I was taking insulin. I was pricking my finger every day. I was in and out the hospital due to my diabetes, my blood pressure, this a lot of stuff.
I'm guessing all that made you realize time to try and get rid of this weight.
Yes, sir.
How'd you find Dr. McAllister in a weight loss clinic?
Well, I was employed at Truman Medical Center, and I was like, something has to change. My mama had kidney failure. Mm-hmm. She had diabetes. And I took care of her for 10 years, and I seen the down effects of what diabetes does to your body.
You didn't want to be that person.
I didn't want to be that person.
Yeah.
So I took care of her for 10 years until she took her last breath. So I went to dialysis Monday, Wednesday, and Friday with her. I seen that she had to get dialysis Monday, Wednesday, Friday. I see how her body changed with the diabetes, with her weight loss, with the weight gain, with the water retention. You had to watch your phosphorus. If phosphorus make you itch, you had to watch what you eat, what you intake. And so I just watched how, when I took care of her, I just seen the
You didn't want to be that person?
No.
So, what was the process leading up to surgery like for you? What did you have to do?
The process with having the surgery.
Yeah.
I had to go through the psych. I had to go through many, talk to different doctors just to see did I want to do it. I had to talk to different doctors. They check your blood. They check everything.
They make sure you're safe to have
just
the
to make
surgery.
sure you're even safe to even go under.
And so, have you had to make changes in your lifestyle after surgery?
Yes, you do.
What'd you do?
I had to change my whole eating habits.
All right, so tell us about what you do and don't eat now.
What I don't eat is junk. I was eating chips, pop,
Oh, they're so good.
fried foods, greasy foods, out to eat. When I eat out to eat now, I get the kids menu.
That's impressive.
And so when
you're just eating less food now.
less food.
Yeah.
And I cut back just from the greasy.
Are you continuing to lose weight, or have you kind of hit a plateau?
Right now, I'm at a plateau, but I'm still losing it. I'm not even trying to lose it no more
Yeah.
because I'm at my goal weight now.
That's awesome. So, what's the single biggest challenge you faced in all of this?
The challenges that I was facing when I had it, before I had it, I couldn't get around. Now I can get around, I can walk, I can do more activities. Like when I got here as an employee, I couldn't barely get through my day-to-day operation. Like I'm a supervisor, so I have to go on each floor. I have to tell my colleagues, hey, I have to go check on them. Y'all have everything just to start your day.
Yeah.
Some days I couldn't do that.
So, do they recognize you when you come on the floor still?
Yep. Oh, they recognize me. They're like, oh, is that Lachey?
Is that Lachey?
Like this morning.
What happened to you?
They seen me this morning. They was like, oh my God, we see the transformation.
Yeah.
Yes.
That's awesome. So, now you talked about your mom, but we understand that there is another reason you wanted to be healthier.
My grandbabies.
Oh man, that's a
My
good reason to be
baby.
healthy right
Yes,
there, right?
that's
You got to
correct.
help raise that,
Yes.
and just congratulations to your beautiful grandbaby and to that family. That's terrific.
Yeah.
And look at that picture. So now, Dr. McAllister, some people think weight loss surgery is an easy out, but we really know that that's not true. But they don't realize how challenging it can be. Talk to us a little bit about that.
Well, yeah, and I think Lachey has pointed that out beautifully, that, the operations are an important tool, but it's not the easy way out, and it is a lot of hard work and dedication. And Lachey and I were talking earlier about her morning walking and exercise routine, and so the surgeries are important tools to get patients going in the right track, but similar to bariatric surgery, the GLP-1s, any of the medications, nutrition and lifestyle interventions are a key component of all of it. Obesity is a difficult to treat disease, and it takes a lot of work and multiple different treatment arms.
Correct.
So Lachey has had gastric bypass, but there are different kinds of weight loss surgery. Talk to us a little bit about how do you know which one is right for which patient? You mentioned a few of them earlier, but kind of go through that with us a little.
It's a great question because there's not necessarily one operation that's right for every single patient. It's really each individual patient's health history and risk factors. And so a patient who has diabetes, we may discuss with them more operations that involve a bypass, such as the Roux-en-Y gastric bypass or the biliopancreatic diversion with duodenal switch.
Those are all our big words there.
It's
We know they're different surgeries.
Yeah.
And so, yeah.
They are. We tend to abbreviate because that's a mouthful.
It just falls out of your mouth.
It does,
like
yeah.
It's normal stuff.
And the study we're discussing also shows that a sleeve gastrectomy is a very effective treatment for diabetes, not quite as effective as what we see with some of the bypass procedures.
So have the numbers of patients requiring that dropped off because of drugs like Wegovy, Zepbound, Ozempic, and all those?
Yes, I think we're certainly seeing a decrease
Yeah.
in surgery referrals. And part of that, it's a good thing. We need additional treatment arms. But what we know historically is that less than 1% of patients who qualify for bariatric surgery ever had bariatric surgery. So hopefully with the popularity of this medications, it's bringing more people to the conversation and the
bet.
topic. Hopefully it's making all physicians more comfortable in discussing weight with their patients,
and
which
you've
has
got
been a
something
difficult
you can
thing in
do,
the past.
Yeah, medically, and my guess is that there's going to be plenty of room for both, of both these different things. And is this all covered by insurance?
Majority of insurance do cover the bariatric operations. There are some exceptions, and then similar with the anti-obesity medications.
And John, when people do this kind of surgery and have the success Lachey has, pretty typically their lives are transformed, their diabetes is under better control. Is that the normal outcome, or is Lachey the exception?
It's the normal outcome. I mean, the data is profound, and it changes from surgical site to surgical site. But overall, there's significant weight loss and significant weight loss maintenance over time, which is really the hard part with typical caloric restriction-induced weight loss is the weight cycling. So yeah, it's pretty typical data.
Yeah, it's pretty impressive data. Congratulations. But we're going to have some questions. Let's head to Studio B with Alexis. Alexis Del Cid, how are you?
Good morning. Doing well.
Where's the blue? Where's the blue? You got red on today.
I'm still celebrating the Chiefs win. I'll bust out the blue tomorrow.
All right, well,
We got 2 days
I got
to
a
do
little
this.
blue here in the office that I can always show.
Yes, that's right.
I got my blue Royals tie, I got my blue shirt, and I got my couple of blue pins on. So, I'm blue.
Well, then check out Lachey next to you. She looks amazing
I'm
in her
saying
blue
that's even better, no
pantsuit.
question about it.
Just
I could break out into
beautiful.
I could sing about some Royal songs or something like that if you want me to. Song blue, everybody knows one.
Shall I get to the questions, or do you want to keep singing?
No, you should probably
I'll get to the questions.
before this deteriorates any further.
All right, Yen Liang has a question, and he has a couple questions in one, so I'm going to summarize. He wants to know if bariatric surgery can impair the absorption of vitamin B12, and could the reduction in gastrointestinal nutrient absorption because of surgery pose a risk for a woman who wants to become pregnant or her baby?
Good question.
Yeah,
Who's taking that one on, team?
I'd be happy to. So,
All right.
Yes, correct. The bariatric operations can change or affect how we absorb various micronutrients, and vitamin B12 is a prime example. And so with these operations, patients do have to be diligent about continuing on a vitamin regimen after surgery. Hopefully we're prescribing some new vitamins and getting rid of some of their prescription medications, such as diabetes medications. But it does require patients to adhere to vitamin supplements, and so B12 can be taken by mouth, under the tongue, sometimes an injection in the muscle. In regards to pregnancy, yes, it is safe to become pregnant after bariatric operations. We advise and recommend that patients wait really a minimum of at least 1 year, and ideally you want weight to be stabilized prior to patients conceiving. So certainly a great question. Important thing after bariatric surgery too is that it can significantly improve infertility in women who previously couldn't conceive, and so that's something that we always have to caution of during that weight loss process.
You can actually become pregnant now.
Yeah.
Well, there you go.
Jean Raridan has a question for Dr. McAllister. Jean would like it if you could define what is bariatric surgery. What are you doing in there?
Oh, sure. So bariatric surgery, there are a variety of operations that we perform. In the United States, the most commonly performed operations are the sleeve gastrectomy, the Roux-en-Y gastric bypass, and the biliopancreatic diversion with duodenal switch. With the sleeve gastrectomy,
We just talk about that one because those
Sure.
are really
It's a lot,
complicated.
yes.
Yeah, it's a big word.
yeah. With the sleeve
I like that
gastrectomy,
duodenal sort of switch thing. That's interesting.
with the sleeve gastrectomy, we essentially remove approximately 75 to 80% of the stomach. So the remaining stomach really ends up looking like a long, skinny banana. And so it also, you can't take in as much, but we see again more increase in the stomach emptying, enhanced nutrient sensing. With the gastric bypass, it's a smaller stomach pouch, and then we actually bypass part of the small intestine and bring that up to the pouch. And the BPD, really kind of a combination of those two with a sleeve and more aggressive bypass.
So lots of different types of things to do in the surgical team with the patients. Sit down, talk about those options, pick the right one.
Yeah,
Which
absolutely.
one did you have?
I have the Roux-en-Y.
The Roux-en-Y. Okay,
Gastric
so this is a
bypass.
little bigger deal though.
Yeah.
Yeah.
Lachey, Jeremy Yenser has a question for you. He wants to know if you had to make any adjustments in the ways that you exercise post-surgery.
Well, you can probably exercise.
Oh, at first I couldn't, but now I can do everything. Lift weights, I can run, I can jump, I can do everything.
That's pretty awesome.
So no limitations,
No
in
limitations.
what you can do. That's fantastic. And Jill has a question. She wants to know, was the surgery itself difficult? Was it hard to recover from it? How quickly were you back to normal?
It wasn't hard to recover. The pain, oh, it was enormous. But after the second day, I was able to get up and move around. But you have to get up and move. That's the key. You got to move around because you can't just lay. because you would be stiff.
We'll put you on a poster and have you say that to everybody who walks in here. You got to get up and move.
Yes.
No matter what your
And
disease
let me
is,
tell
you got to get up and move.
They will make you get up and move.
Yeah.
We've heard so many patients say that post any kind of surgery. The surgeon comes in and says, all right, time to get up. You're going to do some laps around the hospital.
Yes.
Yep.
Lachey, I have a quick question for you. Are there any foods that you can't tolerate anymore?
Beef, ground beef,
Interesting.
can't do it.
What happens if you have ground beef?
Oh, baby. You will go.
You have a
to
baby?
Oh no, oh baby, you will go. It will wake you up. You will either throw up or you will go to the restroom.
You have to go
All right.
up.
Why is that?
Well, we'll see a variety of different food intolerances after the operations. That first year, although a year seems like a long time period, that's really early in the lifespan of these operations. And so early on, foods may be difficult that later patients are able to resume again. Some patients do have certain food triggers that just don't sit well with them. But for the majority of the time, patients can adapt and then get back to a full variety of foods and then those healthy food options as well.
That is pretty amazing. And did you get to stop taking your diabetes drugs?
I don't take no more
Yeah.
diabetes.
Amazing.
That's awesome. Well, this has been a great discussion. I'm grateful to our guests for being here. I want to hear some final thoughts before we go. Lachey, final thought.
If anybody that's want to get the get the surgery, I say go for it.
All right. I like that. It's like she's an ad for you there, Dr. McAllister.
Yeah, I think she said everything I need to say. This is the best part of the job, seeing how patients have a new lease on life, the activities they're able to do with their family, friends, children, grandchildren. It's the best part of the
That is
job.
awesome. Dr. Tifo.
I'd like to just say we need to destigmatize obesity treatment and get more people coming to the table to either try the new drugs, lifestyle interventions, or surgery. And it just needs to be talked about more. People don't need to be living with these conditions and putting themselves at risk long term for all these health outcomes.
And isn't it fair to say obesity is not a choice, it's a
Not a
disease?
choice. It's a disease. Very clear.
And some of what our fast food industry and others reinforce with the images they project and
In our modern environment, it's hard to not gain weight in our modern environment. It's very difficult.
We don't have to run out and hunt and forage.
Right.
And going to Whole Foods is not the same. Going to the grocery store or going to Costco, not the same thing.
Subscribe to our Morning Medical Update and Open Mics with Dr. Stites podcast. Now everywhere podcasts are available.